it's Lockie back in for another episode of the Physio Corner. And today, as part of World Physiotherapy Day, we have our physiotherapist here, Lizzie, who has a special interest in women's health. Welcome to the show, Lizzie.
Thanks, Lockie. Cool.
So my one question today is, following childbirth, how quickly can women expect to get back to running?
Usually, we suggest women come to see a physiotherapist who specialises in pelvic health or women's health at about the 6-week mark, and that way you can get an assessment of how your pelvic floor is functioning and your abdominal wall, and generally your cesarean is healing quite nicely at this point. And then we can look at what's happening in your life with the new bub. Are you breastfeeding? Because your hormones are still a little unstable, so there's still conditioning of the body we need to be mindful of, and if you exercised during your pregnancy and how long you've had off. But then we can look at a return to a run program, and generally we're looking at about 12 weeks postnatal.
Cool. So 12 weeks for most people is realistic to get back running. Cool. Perfect. So today, as part of World Physiotherapy Day, Connor, I have one question for you. How has physiotherapy personally helped you in your recovery from foot surgery?
Lockie, well, I've worked with a lot of the physios in the clinic here. I think we've got some of the best physios around. I'm not too biased. But I've worked with Scotty and Stent especially to try and get me a bit of a rehab plan and a return to run plan. And they've been really good in collaborating with my coach as well to make sure that I can sort of slowly build my way back into running. I think it's important with physio as well to know that they'll give you your rehab exercises and try and follow through on a plan that works with your general sort of daily life plan, rather than just giving you something that doesn't work with when I'm training or anything like that. So the boys have been really helpful in getting ready for that and getting me back running.
Cool. And my guest today is Jordan. Welcome to the show, Jordan. Thank you, Lachlan. Cool. So my question today, Jordan, just one question, we'll keep it short and sweet. What's the most challenging injury you've ever treated in your career so far?
There is many. The one that comes to mind is a lady called Jodie in her mid-30s. So she had terrible knee pain and pathology. She wasn't winning with her pain. Rehab wasn't really working because her pain was so high, so referred her to an orthopedic surgeon. He, actually multiple surgeons had about 3 to 4 cracks at both knees, still in pain, and then she had to get both her kneecaps replaced, which she responded really well to, and rehab was going really, really well, kicking a lot of milestones, and the pain was significantly dropping, and then unfortunately she had a complication where she tore her quadriceps tendon in her knee. Really set it back, but then we caught it early. The orthopedic surgeon repaired it, and now she's killing her rehab, and she's doing really well.
Different. I've been informed that I've got to pass on the interview role to Connor. So, with a heavy heart, there you go, mate.
Thank you, Lockie. Welcome all to the Physio Corner. I'll be your host, Connor. And today we've got a very, very special guest, the host of the Physio Corner, Lachlan Skinner. Welcome to your own show.
Great to be here again. Yeah, it's really good.
Lockie, as part of World Physio Day, we're asking all of our physios questions about their role in rehab and recovery, and one of your special interest areas is lower back pain. So one of the questions that I've got here for you today is, how can physiotherapy help those with lower back pain, and even more so with chronic lower back pain?
Great question, Connor. So, very complicated topic, chronic lower back pain, but in general it's defined as any back presentation that persists longer than 3 months. I think it's important to note that there's no specific, one-size-fits-all treatment that will help every person. So there's many factors that can go into a person's presentation of back pain, like sleep, mental health status, exercise, previous history of back pain, as well as many other things. So I guess as a physio, it's about trying to assess each person for what factors may be contributing, and then make an individualised plan moving forward for them.
Fantastic. All right, well, thank you. I'll hand the clipboard back now to continue as host of the Physio Corner, but thank you for joining our own show today.
Thank you, Connor. Thanks, guys.
Hey everybody, Stent here. You may have seen that I haven't been in the clinic for about 6 weeks now, and unfortunately I'm still away for probably about another 7 weeks, 4 months total, just down in Brisbane at the University of Queensland, St. Lucia. Quite a beautiful campus, as you can see. Just doing some further study, completing my Masters of Sports Physiotherapy. So it's a full-time 4-month intensive block where we're on campus Monday to Friday, doing a lot of practicals, doing a lot of learning, and the end goal is to be better physiotherapists and deliver a better product to you guys and have better outcomes for our patients. So I'll see you when I get back. Thank you very much.
So we've got Rodrigo. So as a part of World Physiotherapy Day, Rodrigo, I just have one question for you. What is your greatest experience as a physiotherapist in your career so far?
I guess that the greatest moment that I had in my career was working the Olympic Games.
Very
was
cool.
just a couple of weeks, but was intense. See all that athletes that I would never mind to see in my life, close to everyone, you know, and treat some of them. It's funny because when you think about Olympic Games, you just think about the athletes, but the majority of clients that you had was referees and judges and these kind of things, because they had so much pressure in that as well that they get some pain.
Okay, so not just the athletes,
not
the
just the
officials.
athletes,
Very
yeah.
interesting. Okay, cool. Thanks, Rodrigo. See you next.